I guess the most effective operation that we have for a hip problem or a bad hip is actually a total hip replacement. But there's only certain instances when you might need that. But that's probably our most successful operation invented in the field of orthopedics. And it's actually probably the second most successful operation ever invented that we perform on people. So the first is, people always ask what's the first, and it's cataract surgery. It's very, very successful for people's eyes. And hip replacement is a close second in terms of helping people get back to what they want to do, and it makes them really happy if they've got really bad, painful joints. So that's probably our most effective, proven treatment that we have that's tried and tested. And we're getting better and better at it every year, such that patients, just recover so quickly now. It's amazing compared to 10 or 20 years ago. Absolutely not. I think though surgical intervention can be really successful in the right circumstances and for the right patient, it's definitely not always required. And I think the first thing that we should always try when someone's got pain around the hip or the groin is sort of natural methods and non-operative methods of sort of treating patients. So that can be various kind of exercises, seeing healthcare professionals that we work really closely with, like physiotherapists or osteopaths or strength and endurance trainers. So there's various people who can kind of help with your pain where there's nothing really invasive that's happening. You can also then try slightly sort of increase things like medication. Some medications can really help, and they don't just have to be pain medications. There are various other types of medications and patches we can do. Sometimes for me, I might offer some sort of injection into the sort of painful area, whether it's a hip joint or a muscle or a tendon, and we can inject various sort of therapeutic substances that can help. So they can be things like anti-inflammatories or lubricants or other sort of things that may help you heal. So there's a lot of things that can be injected. We don't always know how much some of these things work, and we're gathering evidence, and sometimes we think some substances are brilliant and then they're not that good. Yeah, so we try most of those things, and if things weren't really working, we talk about surgical interventions, and then we'd probably start with like minor things first before we stepped it up to possibly major. So absolutely, I'd say 80% of patients that see me don't need to have an operation. A great question. I think the best thing is to try and stay in good physical condition. It's really important for all of us for many things, but in terms of your hip, there's a lot of muscle around your hip joint. It's really far deep in your groin, actually, the hip joint, and it's surrounded by gluteal muscles and adductor muscles and abductor muscles and all these muscles that have different names, and there's tendons around them. And I think if you can keep strong, and also I think stretching is really important, keeping supple, especially as we get a bit older. It's important before you do exercise to kind of to stretch and warm up, and also to warm down. Lots of us, including me, sometimes don't bother with that, but it's really important. So that's the best thing. I think try and keep a good weight as well if you can. Really helps take the pressure off your joints. And I think, yeah, just make sure you take responsibility for your own health, because you're in control of keeping your hips going as long as possible. But sometimes there are other factors that we can't control. Sometimes we get injuries. Sometimes if we're training for something, we get overuse injuries. But we just got to be sensible. And the key, I would always say, is see a really well-qualified specialist with a great reputation, and then you can kind of find out quickly what's wrong and get good advice from there. I guess be someone who's really medically fit and well. So that's the first thing, because when you're having a procedure like hip surgery, it's a little bit more risky if you're not very well or have lots of medical conditions. So if your heart, lungs, kidneys work really well, and you don't have lots of illnesses where you have to take regular prescription medication, that would be a good start. So if you're fit and well, that's great. I guess it helps if you're a bit younger, though we know lots of patients or older adults who are in really good shape. I think it really helps if you're lean as well. So from a surgical point of view, if you're carrying a little bit less, I guess, fat around your hips, it's easier to kind of find the hip and the joint, and you can do much smaller incisions. The surgery can be much quicker, and there's kind of less associated complications. So the ideal candidate from our point of view would be someone who's kind of relatively medically well, fit and trim. And the key also is that you need the procedure. So, you know, someone who's got really bad hip pain, and they've tried everything else and they're really fed up. You know, hip replacement is a fantastic procedure. It's got a very low complication rate. And, you know, normally, certainly with my patients, by about 2 weeks when we see the patients, just to check the incision's okay, they're loving it. They're really happy. They're walking well, no walking aids, and they're starting to think about a normal life again. So yeah, it's got to be kind of a good patient, I guess. They've got to need the procedure. People like me, my team, we've got to do it really well. Okay, so I guess like any operational procedure, a total hip replacement is much the same. It's really required when nothing else is working, and you're kind of, I would say, fed up and miserable. So it's not always best to try as the first treatment. So you want to try, you know, maybe limiting some of the activities that aggravate you if you can. Sometimes it's really hard because you don't want to stop things you enjoy. You don't want to ruin your quality of life. But it's definitely worth seeing like a physiotherapist or an osteopath, trying some exercises, trying some weight loss if you're carrying a bit of weight, try some of that strengthening and stretching just to see if your hip pain can sort of reduce a little bit. Then, as I said in another video, it might be worth trying some pain killing medication just to help you kind of get on with things. Potentially, sometimes some injections can help, but really it's needed if nothing else is working or the hip's very badly damaged. And I guess, you know, if you're miserable and fed up and you're not fearful of having a procedure, then it's the right time to consider it. I think if you're always really worried about having this procedure and you're always kind of just, you know, thinking almost, oh, I wish I wasn't having it, then it's definitely not the right time. It's got to be that you want it, you're ready for it, and you want to move on and move forward with your life. It kind of depends on the surgeon, and I guess it's changing as the years go on. It's changed a lot since I qualified and worked about 20 odd years ago. It's changed a lot. So for me, patients, pretty much all my patients go home the next day. And in some instances, certainly in my NHS practice, some patients go home the same evening actually. And all patients are walking with a physio kind of helping them and some crutches for comfort about 3 to 4 hours after the procedure. And you're allowed to walk, you're allowed to put all your weight on your operated leg, and you're allowed to do all movements. So previously, you know, surgeons, especially when I was training, were worried for about 6 weeks that you shouldn't do certain movements like bending forwards or crossing your legs or sleeping on your side. But a lot of us now, because of the, I guess, the techniques and we use and the implants we use, we're not so fearful of that. So we're happy for patients to get on with all activities, all movements as comfort allows immediately. I would say most of my patients will drive about 2 weeks later, as long as they're doing well and they can move their foot and kind of sit comfortably. And yeah, that's it. The main thing would just be to keep your wound dry for about 2 weeks. So we put a waterproof dressing on. And as I said, after 2 weeks, patients feeling really good. And normally by 4 to 6 weeks, I mean, they're kind of flying and they're really happy. So that would be my post-operative advice, but it may differ from surgeon to surgeon. So best to check with your own surgeon.